average parent gets less than 10 minutes per year with their kid's pediatrician. But kids get sick 8 to 12 times per year. There are 123 emergency room visits for every 100 infants. And there's a massive need for additional care from pediatrics.
I'm so excited for this conversation, especially as a member of the sandwich generation myself. And for anyone who's not familiar with that term, sandwich generation, right, is someone who is sandwiched between raising children and also taking care of aging parents. I wanted to see a show of hands. How many of you feel like you identify with that moniker, sandwich generation? That's a lot of the room. I feel like there's going to be a lot of nodding along during this session. So I can't wait to get right into it. So speaking of which, digital health solutions like Grayce and Summer Health are transforming our caregiving experience. Just to start us off and get the lay of the land, in 1 minute, both of you please, give us your elevator pitch. What is your platform and what does it help people do? Julia.
Yeah, so Grayce is basically a virtual social work platform. We focus on helping people navigate caring for any type of loved one or even caring for themselves with a dedicated social worker and a whole platform of self-serve tools.
Thank you. Ellen.
Yeah, so the average parent gets less than 10 minutes per year with their kid's pediatrician. But kids get sick 8 to 12 times per year. There are 123 emergency room visits for every 100 infants. And there's a massive need for additional care from pediatrics. At Summer Health, we offer text message-based access to pediatricians. We answer all inquiries in 15 minutes or less. Think of it like your best friend is a pediatrician who happens to be able to answer your inquiries anytime, day or night.
That's fascinating. And before we get into exactly how all that works, super curious that given that the caregiving burdens that you are both solving for are often invisible, taken for granted, unpaid, undervalued economically, how did you raise funding? Tell us how you raised funding, Ellen.
We've been very fortunate. We have backing from some of the best and most successful minds in Silicon Valley. We've raised over $19 million from Sequoia Capital, Lux Capital, and Seven Wire Ventures. How did we raise funding? I mean, we feel very fortunate to be surrounded by people who very acutely feel the problems that we feel. I'm a mother. I have 3 young kids, and I deal with this constantly. Our investors are the same way, and they really understand, identify, and value the problem that we're solving. So we feel very fortunate to be joined on this journey by people who deeply understand and empathize with the problem.
That makes sense.
Yeah, I'd say it absolutely comes down to people understanding what you're solving for. We raised our Series A in the last 6 months, and it really came down to having investors that understood not just caregiving, at one end of the spectrum, but the whole end of the spectrum. And so we really found those that had personal experience with the problem and understood in talking to clients, being really able to validate what that meant for people's lives.
Yeah, it's fascinating. Investors feel like they have to, connect to the issues that you're solving for, and it sounds like you found those investors who do just that. And by the way, before we go on, I just want to remind everyone that this is an active conversation. There will be Q&A, so as we're talking, please be thinking of your questions. I'll be looking out into the room to look for you to raise your hand, so be thinking about your questions. So let's go back to the problems that you are solving for, right? Caregivers, especially those who are sandwiched, right, between parents and children, and other family members, and not to mention themselves, right, face many burdens when navigating the care system, right? And some of them might include lost working hours and income, less personal time, difficulty balancing those demands, financial stress, lost work productivity, burnout, navigating difficult health situations, not to mention the insurance system, knowledge gaps, scheduling, paperwork. There's so much to it, right? How are your solutions, both of you, helping solve for these kinds of challenges? Go ahead.
Yeah, so I'd say we really serve as a complement to the medical care system, right? We're not the doctors or the nurses, we're really the social workers. And so you think about whether people actually have an acute medical problem or whether they're navigating broader types of care, it's really about supporting people in their community, in their home, navigating the entirety of the system. So not what's my treatment option, but how am I going to pay for that care? What's available to me? Do I have my legal affairs in order for whatever that type of care is?
And how does that work? How does someone use the system to do that?
use Grayce specifically.
Yeah, use Grayce, yeah.
So people sign up for the experience. They come in, they're matched to a dedicated social worker. Usually there's an initial intake call, and as part of that, they're really conducting motivational interviewing, a biopsychosocial assessment, and from that, creating a personalized care plan, and then being able to identify resources that are most relevant to that individual family in the community, understanding what it is that they actually need set up, and how do you navigate, but not just passing people off. Like, that's navigation 1.0, that's dead, right? The next wave is really, how do you take something off someone's plate, right? Caregiving's not a coaching problem.
Right.
Caregiving is a help me get it done problem.
Yeah.
This is a job I've never had.
Yeah, it's new to so many people. And you mentioned that you literally can text a provider and get an answer in 15 minutes. How are you seeing that start to transform that whole process for parents?
Parents feel like they are supported in a way that they don't necessarily feel in their children's health and wellness journey. It's primarily because health doesn't just happen between 9 and 5, and it doesn't just happen around the time you have your child's well visit. It happens when your kid is 2 3/4. It happens when your kid is 7 1/2. You know,
It's at a very inconvenient time, I feel like, too.
Usually at 9 p.m. on a Sunday night, which is what happens in my house. So to be able to establish a longitudinal relationship with a provider, what we actually do is we assign you to a provider with whom you build trust and you build a relationship. It's not, one of my biggest qualms with most telehealth platforms is you parachute in, you see somebody, and you never see that person again. So that person gives you advice, you're not sure how much of that advice you can trust.
Yeah.
You're not sure how much of that advice is authentic to what works for you, your child, your family. That is very different from the kind of longitudinal care that we give. And we're able to do so because our modality of care is what I like to call pseudo-synchronous, meaning it's not totally synchronous. You're not FaceTiming with a provider. We're able to increase the supply of provider hours by making it this pseudo-synchronous modality of care.
When it's actually convenient for the parent.
That's right, and we offer it 24/7. And if it's
So your kid's sick in the middle of the night, they can get up and text their
I mean, I had my middle child threw up at 3 a.m. 2 weeks ago.
That's when it
Summer
happens.
Health, had a prescription in 15 minutes in my hand. It was amazing.
Wow, that's incredible. I want to just pause for a moment and see if we have any burning questions in the audience. Want to make sure we're recognizing you if you have a burning question. Yeah, I have a question right here. So please identify yourself and your affiliation and ask your question.
Hi there. I'm Tim Leshin. I'm with the Association of Schools and Programs of Public Health, but I'm going to ask a more personal question. My mother-in-law, who's in her 80s, would be very, very skeptical of having a social worker assigned to her just because who is this social worker and why aren't they a doctor, those kind of things. Can you talk about how you overcome the skepticism of the elderly population?
Yeah, it's a good question. People need to be comfortable, right, to have confidence in the care. Yeah, good question.
So in our model, we're not actually assigning a social worker to your mother. We're assigning a social worker to you and helping you in navigating. And you're welcome to bring your mother into the conversation if you so wish. Your social worker can work with you on helping and coaching you on how to involve your mother, how to navigate those complex conversations. But it's really focused on how do you help the caregiver through that process, right? They're a key stakeholder in care. And you're navigating those personal dynamics, that sense of trust, that willingness to do those actions that you need, that they need, right? Especially as they're getting older and not necessarily wanting to change, so.
Yeah, I think what's really interesting about both of your solutions and platforms is that they're really focused on the caregiver, right? You're supporting the caregiver, like a doula, right, is supporting like a new mother, right? Not the baby, right? It's not a baby nurse, it's a doula supporting the mother. And I really noticed that about both of your solutions. Like you're there to actually help the caregiver, whether it's the parent, right? The child, the adult child, or whatever it is that's where the support level is. And that feels like a different part of the model. That said, curious to hear your thoughts on the limitations, right, of these kinds of platforms. The doctor's not in the room, right? They're not taking vital signs, right? They're not looking at, to your point about it's not a telemedicine appointment. They're not looking at, whatever it is, the rash, or listening to the cough, or they're not palpating, right? They're relying on the caregiver to tell them the story. Caregiver might be upset, or in some cases even hysterical, right? Or not seeing the situation clearly, right? How do you actually interact with the in-office provider, right? Is there Are you just supplementing? Are you trying to replace? And how do you try to solve for some of those limitations? Ellen?
I don't believe that telehealth will completely eliminate the need for in-person care. I think that would be naive. And so hybrid is obviously a very buzzy topic right now. Where we do step in, though, where I do think more can be done from home is we've actually leaned into at-home diagnostics. So, for example, we have an ear infection device that can help you detect if your child has an ear infection. We mail that to your home, and that's a very objective source. Instead of subjectively saying, well, my daughter's tugging at her ear and has a fever, that can't diagnose it. I think with the advent of AI, we're actually also leaning into tools that you can take a photo of the back of your throat and it will diagnose if your child has strep throat. Same with UTIs, which are all common conditions that can actually be treated from home. And so we are big believers that you can push more into the home and you can do more from home, but it will never fully replace the need for in-person care.
And then to that point, say, I, as a parent, I'm texting, right, with a provider, right, on Summer Health, and is there a situation where the provider would say, actually, I really recommend that you go to the doctor?
Yeah, about 10% of the time we do refer in person, and that will either be to the emergency room or your provider. But when we do so, we try to hold your hand through it. So we'll say, we recommend you go to the emergency department. This is the ER that you should go to. We'll make the expect call. Or you need to go to your primary pediatrician. Text us tomorrow when you're in the office, and we'll be there to help support you through that journey.
Oh, wow. So there's like a sort of extra layer of support for that appointment. And do you have something similar? How are you mitigating the limitations of the digital platform?
Yeah, so I'd say we're not actually treating medically, right? We're more the navigation layer.
Yes.
I think about the virtual world, the death of virtual care has really been overstated. I think a lot of it comes down to how does that integrate between virtual and in person. For the type of support that we're doing, that type of social care, that doesn't always require being in someone's home and being able to see the whites of their eyes. It can vary depending on the nature of those needs, but there are ways, for example, we can even do that initial assessment of the safety of a home environment, be able to flag, hey, you might need an in-home safety assessment. Here's how we can go get that for you. But our model is really about then integrating into the local community. It's actually finding those resources that are available to someone in that community and getting them situated and making sure that it's mitigating the risk factors that are there from a social standpoint. So we think about it as a complement to medical care rather than either or.
So like for someone calling about their mother, right? Would you maybe do an assessment and recommend, here's a physician or here's a list of physicians that we recommend that's local to you.
If there was a need for medical care.
Yeah, the need.
Certainly.
Yeah, and I would love to have help navigating this myself. Do we have another question in the room? Yes, we do over here. And we're bringing a mic to you. And if you just identify yourself and then ask your question. Thank you.
Yeah, hi, Alicia Bazzano from Hopkins. I just wonder, it looks like your platform is primarily aimed at employers, and how do consumers get to you? And then vice versa, how did you choose to directly work with consumers rather than the other?
Perfect. Yeah, Julia, go ahead. Sir.
Yeah, so we've started with employers. We'll ultimately go to the payer market. And the start with employers was really based on, we started with elder care and we looked across the different channels, and I came from the payer world and had a sense that at the time that we launched, the market wasn't quite ready with the financial model of taking that to into healthcare to start. But on the employer side, now the Fed says care is the second greatest reason why talent's leaving the workforce, right? With the dearth of child care, the dearth of elder care, the dearth of medical care, who do you think's doing that now? It's us, right? So those are people dropping out of the workforce. Those are people with all the different types of challenges that Holly spoke to. So the way we approach that is every time we're launching with an employer client, we're doing a whole launch program and a whole communications program through the course of the year. So we're a B2B2C type program. And we set expectations low to start because this is a new topic. This is like fertility and mental health, like 5 years ago, right? Where people are still learning about the prevalence and the burden in their population. But it's honestly one of the easiest topics to demonstrate ROI and to demonstrate satisfaction. The second you get in there and people can actually see what's going on, and you make people comfortable in talking about that to their fellow employees, it catches on like wildfire. People are not used to having help like this.
And it's ultimately saving money, I'm sure, for a lot of employers. Ellen?
It's funny, my answer is very similar to Julia's, which is a little bit of personal DNA. I cut my teeth at a direct-to-consumer healthcare business, and that was what I knew how to build. So we also saw a great pull and a great need from individuals who said, I would pay for this. That being said, we have started to see more tug. We do also sell through employers now, and have started to catch the attention of payers as a result. I think it is probably a generalizable principle that going directly to payers can be challenging, especially if you are either in an avant-garde area of the medical system, or the modality of care, or the way you would want to get reimbursed is new and novel. It makes sense to go first to those who may be more willing to experiment and then go to the plans. But they are very forward-thinking, and I've actually been very pleasantly surprised by how embracing they are of these new technologies.
That's good to hear. We have one more question in the audience, but I just want to remind you to keep it tight because we have about 3 minutes to go.
Great platform and great session. Quick question regarding summer health. It's a very beautiful Venn diagram of 15 minutes and longitudinal. That's incredible. My question is on the talent management side. As a clinician, to say that I'd be on call 365 and have to be responsive for every 15 minutes would be a pretty hard sell. Can you tell us a little bit more about that model and how you kind of recruit and retain talent?
Yeah, I love that question because we're in a very fortunate position. So we're staffed exclusively by pediatricians, all MDs and DOs. Our clinical staffing model is we always have, and we're live in all 50 states, so we're nationwide. We always have somebody who is available to answer your inquiry. You are also assigned to a provider. If you need urgent care, you may not get that longitudinal provider, but your assigned provider will follow up within 24 hours to make sure that you're getting the care that you need.
They'll say, I heard your kid was sick, how are they doing?
Exactly, or let me follow up, how's the fever, how's little Timmy feeling today, that sort of thing.
Right.
And so you can have a longitudinal relationship while also getting quick care.
Yeah, that makes a lot of sense. Running a startup like both of yours is obviously really hard. What's a user story that has really reminded you of why you do what you do and kept you going? Julia.
Oh, goodness. There's infinite numbers of those.
I'm sure.
It's everything from the simple to the more complex. I mean, to give you like a complex scenario, we had an employee who had a spouse diagnosed with cancer, had to be induced early while pregnant, had a baby in the NICU, had a toddler with special needs.
It's the same person having all of this.
Yeah, had 3 loved ones to care for, right? So a spouse, 2 children, both with completely different needs. Most models would just say, here's the phone numbers to call, right? But
right. Good luck with that.
Think about what that person needs, right? Like they got 3 people to keep alive. They need someone to help make it easy and take it off their plate.
Yeah, and you're there to make it easy.
So that's ultimate.
Yeah, I mean, I'll obfuscate names, but you have Shannon, who lives in rural Texas, has 4 young kids. The 2-year-old needs to go to the emergency room. It's 2 a.m. Single mother, what's she gonna do with her other 3 kids? So she texts with Summer Health. She gets peace of mind and quick care. And we can really take care of both her mental health, and her family all at once.
Wow. Final word, last 30 seconds. Where is this headed? What's like the next way that you're going to grow?
We're starting to penetrate the Medicaid community, and we're very excited about that. We want to put Summer Health in the pocket of every single American, whether they can afford to pay for it or not.
Wow. Where's Grayce going?
We're going to the payer space. Social care is the 3rd leg of the stool that's coming next. Government's changing payment models, and we aim to be front and center.
Well, you heard it here first. Thank you both so much. Thank you.